everyone, and welcome to this academic session of the M.Sc program in Counseling and Family Therapy. We shall be focusing on placing counseling and family therapy on the global and national agenda, needs, issues and concerns. And to deliberate on this vital topic of critical import, we have the honor of having amongst us Professor Ahilya Raghuram. She is Professor and Head, Department of Mental Health and Social Psychology at NIMHANS, Bangalore. We also have Professor T.B. Singh, Professor and Chairman, Department of Clinical Psychology, IBAS, Delhi. Also present to participate in this panel discussion is Dr. Rajesh Sagar, Associate Professor, Department of Psychology, AIIMS, and Secretary, Central Mental Health Authority, Government of India, and Dr. Jagdish Kaur, Chief Medical Officer, DGHS, Ministry of Health and Family Welfare, Government of India. And I am Professor Neerja Chadda. I'm a Professor of Child Development in the School of Continuing Education at IGNOU and also a Program Coordinator of this program study. To set the ball rolling, let me pose the key question. What is the significance of counseling and family therapy in the context of the mental health scenario at the global level and at the national level, with the global level probably providing the backdrop and the key focus being the national canvas? Ma'am, would you like to comment on it?
As far as the significance of counseling and family therapy, both globally as well as nationally, particularly family therapy has had a long history in the West as an important method of treatment, particularly for problems pertaining to children and adolescents, and more lately problems arising out of substance abuse and other issues. However, even in the West, with the introduction of managed care and with the emphasis on evidence-based treatments, most insurance companies are somewhat reluctant to fund programs of research and, for that matter, interventions which involve family therapy. And so to an extent, it has become somewhat difficult to obtain insurance coverage for family therapies in the West. The scenario in our country is somewhat different because the family's involvement and the family's support was something that we have always taken for granted in this country. And as an informal support mechanism, it has always been present, and most people relied on this for resolution of their problems. However, of late, with all the rapidly changing lifestyles, we know that families are under increasing pressure and family structures perhaps do not exist in the same way as they did in the past. There is a greater degree of dislocation, of couples not staying together, children living with one parent, all these on account of aspects such as work and employment and so on. So therefore, this informal support network that we always took for granted is no longer available. And at the same time, we have a scenario where there is really no organized support system or support mechanism that has been established. And that is where it is imperative to bring this into focus so that we take the necessary steps to establish a well organized system of providing help for both individuals and families that are in need. I would say that it is in this context that, at least at the national level, we need to look at counseling and family therapy services. There's just one other point that I would like to highlight, and that is the fact that particularly when it comes to mental disorders and the most serious mental disorders, including developmental disorders in children, the emphasis has been on the fact that families are the best environment for a child or for a patient to recover. But at the same time, if the family is not provided with the necessary skills in learning how to deal with serious mental disorders or developmental disorders, it places an extreme degree of stress and burden on the families, and that is something that we need to pay attention to.
Thank you, ma'am. Professor Singh, would you like to comment on the need of placing counseling and family therapy on the national agenda?
Yeah, thank you. Just to extend what Dr. Ahilya has said, the moment parents come to know, they want to know what to do with this child. And then going through all those stages of denial, shock, realization, the component which is given by the treating doctor is not sufficient. And what happens, that ultimately the parents become clinic shopper, and there is a very strong psychological gratification that till the time I am this earth, I will do whatever is possible to recover or regain the sight or whatever the physical loss is there of my child. So unfortunately they spend 3 to 11 years, and the child lands in a special school or in a center for rehabilitation, and crucial years of learnings are lost. So in that way this is going to be a very, very helpful thing if things are available on the spot in the community. And as far as severe mental illness is concerned, which she already highlighted, the drug compliance part is very, very necessary, but the psychosocial support through family is a very crucial factor. Because looking at the activities of daily living skills, social skills, and then some of the vocational skill, whatever is available, can be sustained with the support of family. So there is a great need, and that's how currently this kind of manpower is not available, and it is expected that manpower on the massive scale will be available in the community, and they will be able to assist families, and families will be supported. And as Dr. Halya says, that skills to look after these victims in the family is very necessary, and now a time has come where families should be equipped to look after either a child with disability or a person suffering from severe mental illness, or even other drug addicts to HIV, whoever is there. But there is no infrastructure available right now in the country, and mostly the institutional care, they were trying to develop a national network of referral system. The cases should be referred and it will be attended in the institute. But that trend is changing. Now there is a shift from institutional care to community care, and I hope this will go a long way in helping families, and that's how we need to pay attention very crucially to these aspects.
Thank you, Professor Singh. Dr. Sagar, you're a psychiatrist at AIIMS, and you're also the Secretary of Central Mental Health Authority of India. What do you think should be the focus vis-a-vis the need and concerns in the context of placing counseling and family therapy on the national agenda in terms of the delivery system, in terms of providing services in the domain towards meeting the mental health needs of the population of the country?
Fine. I think it is very important to understand that last few, like for many years now, we should know that the global burden of disease, I think the psychiatric disorders has placed quite higher up. Like in the sense that it is projected that depression, the disability will be number 2 in 2020, and where it is just after ischemic heart disease, and we should also understand that out of 10 top conditions of which causes disability, 4 are psychiatric disorders. So what is important to understand that it causes so much neuropsychiatric disorder, almost about 14 to 15% disability is there. So it is very important to understand that they are there and causing so much disability, and so something needs to be done. Now at one point we have conditions which are so prevalent, like we know that psychiatric disorders are so prevalent, and we should also understand, like in developing country like ours, the mental health resources are very poor, like in the sense that manpower is very less, like number of psychiatrists are very less, even as clinical psychologists are very less, so manpower we know are very less. Now the third point is we should also understand that there is so much stigma and discrimination attached to these psychiatric disorders. So what happens that because of the stigma, because of lack of services, so the utilization of services is very poor, like in the sense that it is said that only 10 to 20% of people actually seek a help from the mental health professional. Now in this situation, we know that distress is there, and people are in distress and they need help. So if they are not able to get access to the services by mental health professionals, so perhaps the counselors and will be required, and perhaps they can take a burden from these mental health professionals. And the important thing is that the services can be provided in the community itself and much early in the course of the illness. Now there is evidence to suggest that when we provide services, when we treat a person early in the course of illness, the outcome is much better. Like they can be in the mainstream of society much earlier, their functioning is much much earlier and very effective. So that is why the needs are tremendous. Now we all know that the distress and the which is there, and one needs to communicate. People, they do want to communicate. Earlier times, we knew that the family was the immediate buffer, and they used to. But now with the kind of globalization, with the kind of these families, we are having more of a nuclear system. So and we are in the modern day stresses. So these families are not there. So ultimately, if they are not in a way communicate, so it will lead to a dysfunction, psychopathology or psychiatric disorders. So that is a part for the mental disorders. We should understand that. But leave aside mental disorder, because there are so many physical conditions also we should understand, where the role of family and counseling is very important, in the sense like those dealing with the cancers, those dealing with the HIV and many other physical conditions which are so important, where the role of counseling and family therapy is envisaged, and perhaps and they can play a major role to reduce the distress and dysfunction in the family. And so it's not only the psychiatric disorder but also a lot of physical condition. Now, as what Professor Neerja asked, that how we can do that, there are a number of ways we can discuss more in detail about that. So basically it can be at the primary care level, like primary health center. Like in India, we have very good primary health center healthcare system in our country. Like there is a team of doctor as well as medical personnel, and there is a need to train these medical officers in counseling and counseling techniques. Then there is a need for at the student level, like students again could be at when we talk of counseling at the college level and school level. Then there is a need for these counseling services at the general hospital level. Like as I said, some hospitals, they do have these counselors are there, but not in many places. Then there is at workplace, like there is a talk of employees assistance program or staff counseling services and so on. So and also in voluntary organizations, and the most important also we need to discuss that is in the disaster situation, because there also the need for psychosocial management and will be important. So at these at different setups, I think we need to discuss that where all this can be provided in the near future. We know that we have very good national rural health mission, and we have district mental health program, national mental health program. So somewhere we need to integrate these counseling services. Dr. Jagdish Kaur will be talking more in detail about that. So somewhere we need to integrate these services, their counseling, and perhaps the treatment can be much early, much more effective. And people, it is something like when they see people at times say that to seek a psychiatrist there is a stigma, but they can say okay, if they can meet a counselor, then there is not much stigma attached. So I think to remove this barrier of stigma, I think that will also play a major role. And for times to come, I think they will play a major role, and the need is tremendous. And I think the time has come where, just to give you an example, like in UK, National Health Services, 1/3 of them have counseling services. Like in India, we do not have that data, but let me tell you, it's 1/3 because there the whole task is divided. And most of Western countries, there's so much emphasis on the counseling services, but in India we do not have. But the time has come now. We need to think about it, and perhaps in future we'll have more and more these counselors and manpower to deal with effectively with these disorders, which are mental disorders as well as physical disorders, and importantly as a distress of a person, how we need to manage that.
Thank you, Dr. Sagar. Dr. Jagdish, you're from the ministry. So would you like to comment on the significance of counseling and family therapy in the context of improving the service infrastructure, improving the delivery of services of various components under the national mental health programs, and the other programs which could use counselors and family therapists in terms of a better delivery, better enhancement of meeting the objectives?
Thank you, Neerja. Taking the lead from what the experts have emphasized, we do need counseling and family therapy in the country, and this is not only the mental health program. There are so many other programs, and now that we know that urbanization is taking place, family structure is breaking, both the parents are working, and in our country family has been the main caregiver since traditionally. But now if the structure is not there, it's not being maintained, so we now need to look at how to fill that gap. So we need the family therapy, we need the counseling, we need the counselors, and there is a acute shortage of trained and skilled counselors in this country, and we have facing this at national level, because if you have to implement a program effectively, you need trained persons. And I won't restrict myself to national mental health program, as Dr. Sagar has said that we have the counselors role there, and that is important. And I must say that we have been placing more emphasis on the clinical care, the pharmacotherapy, and the counseling, this which is vital to care of many diseases, that is being neglected. And that is the difference is also, like the experts have said, that what is the scenario globally and what is there in the country. Till now we haven't accepted this. People don't seek counselors help. Straight away the tradition is go to a doctor, and first is this is not there, that we don't go seek the counselors help, they are not available, and this attitude needs to be changed. And we have realized this, and at the national level, and this national mental health program, the component under it, the district mental health program, where we place emphasis on the community care of mentally ill. There now we have included more components like school and college counseling, the workplace stress management, and suicide prevention. All these components cannot be implemented without the trained and skilled counselors availability. They have to be there to implement these components. And if you look at other programs, if we don't restrict ourselves to the mental health care, like the lifestyle diseases, non-communicable diseases, which are coming up in a major way in the country is now facing double burden of disease besides the communicable. And even if you go to communicable diseases like HIV, AIDS, tuberculosis, there also we have a very crucial role for the counselors. We have the ICTCs, integrated counseling and training centers. But unfortunately we are being restricting ourselves only to the counseling for HIV and TB patients. I very strongly feel that this is a very good infrastructure available, and they should expand counseling to for other diseases also. And because we have a network of more than 5,000 ICTCs in the country, and we have acute shortage of trained counselors, and this course will do a not only to mental health program but other programs also a great help when the trained people will be there, and they'll be involved in implementation of the programs at various levels of providing healthcare. And now we have also started diabetes mellitus, CVD and stroke program. This is a new initiative in the 11th 5-year program, and there the counselors are being placed at the community health center level. Below district we are now going. Under the national mental health program, counselor is there at the district level, but now we are trying to go below district and integrating the care. Not only there will be a counselor who will just be doing counseling for one program, but for different components. So that integration is being done, and the need is it's being felt, and that's being addressed at the national level, and it's going down, but it needs to be more popularized so that it's accepted, and then people seek help from right people at right time. As Dr. Sagar said, that early identification of mental health disorders is very important, so people need to be trained that way, so that they are there when they seek help, then they follow the proper chain of referral, and their requirements are attended to at the lowest level of health care.
Thank you, Dr. Jagdish.
May I respond
please supplement
to something that Dr. Jagdish Kaur raised. Madam, you had mentioned that people often, hesitate to go to a counselor and would, in fact, prefer to go straight away to a medically qualified person. That situation, I think, is changing somewhat. At least in metros, I think it is definitely
Urban
changing.
areas, yes.
In urban areas,
Yes.
with greater awareness, and with so much of information being available on the net, many patients, in fact, when they come to a hospital or to a to large referral centers, they in fact come armed with information about, you know, their own diagnosis about their condition, what are the probable medications that they might have to take, and what are its side effects, and so on. And as a consequence of that, some of them are somewhat alarmed by all that information that they have, and therefore some at least come saying, we don't want medication, we would rather go in for a treatment which involves talking to someone and learning ways of how to handle our problems. So that is a smaller subgroup that is also emerging. And since the scenario in India is changing so rapidly, I think that is also something that we need to take into account. And if we have to provide that kind of help for the group which comes specifically asking, that also creates this need for more trained counselors and family therapists and so on. That's the first point. The second thing is what you had mentioned about families being the primary caregivers. In fact, for in mental health issues particularly, and I'm sure for most other chronic medical disorders as well, we generally tend to place the family at the center stage. That is to say, they are entrusted with the major responsibility of doing everything to provide the care for the patient. And at the same time, we never, as professionals, sometimes we don't really take into account the fact whether the family has the wherewithal to provide the kind of care that is necessary. Do they have the economic resources? Do they have the emotional resources, and or not? And often, if they are found wanting in some aspect or the other, as professionals, we tend to blame them all over again for not doing a good job. And I think that is doing gross injustice, because we want them to take over the entire role of providing care without at the same time doing something concrete to actually build up their strengths.
That's a very valid point, ma'am. And therefore, probably the focus is, there's a conscious recognition that you need to shift the focus from individual focused counseling to family therapy. It is whether it is the causation of the problem, let's say an old person suffering from depression. Now, whether in the causing of it or in the elevation, the family members have to be roped in, or whether to enable the family to cater to let's say handle a schizophrenic family member. So you need to generate the emotional resources, as Ma'am Ahilya put it, to enable them to cope with it and provide the requisite support without crumbling themselves. So probably a comment on number one, not just strengthening the counseling support, as Dr. Sagar mentioned, given the scarce human resource available in terms of the professionals trained in psychiatry, we need to nip the problem in the bud so that mental distress gets handled before it gets converted into a full-blown mental disorder, by providing in positive interventions and supports in terms of counseling the individual and the near and dear ones, basically at least the family of the individual, so that the positives are enhanced, the negatives are dealt with in a positive manner, the family interactional mechanism, the interrelationships, everything is addressed so that the unit emerges unscathed and healthy all over again. And the shift, therefore, not just to enhance the, Dr. Sagar gave a very valid, useful information. I mean, in other countries, there's a conscious effort to place as much as 1/3 emphasis on counselors in your medical support team, in the health team. We probably, we need to build up the pressure groups to ensure that even in our national level policy decisions, such a thing gets included. And counseling which is not focused on medical model, blaming the individual or roping in the family to the extent of either thrust the entire burden on the family or just blame the family. So would you like to comment on these twin aspects of providing the counseling support and broadening the definition of the family to family counseling and family therapy? Dr. Sagar, would you want to?
Yeah, I think it's important. I think just to extend the discussion, what happens traditionally in our system. There are two kinds of patients which are at the extreme end. Like one is that the medical model, what Dr. Jagdish Kaur mentioned, that they expect that drug treatment to be there, and they want they're so well versed with the medical model, and a doctor with a white coat and examining and looking at the pulse and using the stethoscope, and that is one side. Other side is, which is perhaps emerging, especially in the metros, that is, they don't want medication, and they don't want to be somehow medicines. Again, they have a lot of myths about medications, and they are very harmful. They have so that is one extreme. Now it is important to understand, I think, as one of the concern that because counseling is not panacea for all the problem. Like at times the medicines may be required. At times, different form of psychotherapy may be required. So, though it's important to understand that, because most the place is there for medication, the place is there for different form of psychotherapy, and counseling is just one part. Where family therapy, we know that there are proper indications are there, and there are contraindications as well. So we need to understand that in that context, which is very important. Though the thinking is changing, the attitude is changing, but it is not either or counseling or medication. I think, and that's very important message we need to convey. That's not, and sometimes people, they do feel that for everything the counseling is the only remedy, and I will be taken care by counseling. That's all. That's not the case. And we need to understand that it's not just the mental disorder, but also physical conditions which are important, and perhaps that is why the need is there that for a medical doctor, that they should be trained for counseling techniques, like because ultimately what counseling means, that giving the gathering the information, you are giving the advice, and so on. It's not only for psychiatric condition, because counseling techniques are important for medical doctor, anyone who is dealing with the distress, anyone who is dealing with the problems in a human being. So there the skill is required. So, but at the same time, anyone who does a counseling does not mean that he becomes a counselor, and so, but at the same time, the emphasis has to be there that about the communication skills, how to give advice, and so the scope is much broadened of the counseling in that regard. So when we are dealing with a family, like say for example of in a family where the person with dementia is there, and how to, because manage, because caregiver burden is a major thing, and how to address the issues. Even in a family where a person has a schizophrenia, and that there also the role of the counseling is so important, and most importantly, there is evidence to suggest that when these principles are applied to counseling and psychoeducation is given, the compliance become much better. Even it is taken as as Dr. Kaur mentioned, that when it has to be supplemented, in the sense that even a person who is on medication, let's say for lifestyle diseases or say diabetes or hypertension, when the proper counseling is given, so that enhances the outcome, in the sense that the medication support is also there, because otherwise what happens, that there are it has been seen that if you don't do that, then there are dropouts are there, and people will not go for help. They will have more complications and so on, not for psychiatric disorder, but also for medical conditions. So scope is much broadened, not just restricting to a counseling for specific type of disorder.
Professor Singh, would you like to comment?
If you see the scenario, the multidisciplinary approach is being used in treatment of mental health as well as in disability and rehabilitation. And when we say multidisciplinary, means the pharmaco part is more developed. And demand of the day is to look into the problems of families, and the non-medical approach, psychosocial approach, you can say. I don't know, somehow or the other we were lagging behind, but the time has come. For example, in severe mental illness, there is something known as psychoeducation, talking about drug compliance, looking after their skills and managing them, and consistent treatment and support. So until and unless a family is aware, it will be very, very difficult, because as Dr. Sagar is saying, all the disciplines dealing with these problems are complementary to each other, and that's how the multidisciplinary approach to extend further up to the level of community, this is the need. If you come to the disability part, the early detection and early intervention is again very, very necessary, because looking after the child, if that intervention is delayed, his crucial years of learning are wasted unnecessarily. So better he comes to the school and starts his education. And the more significant aspect of this training is that this applies also in severe mental illness. If they are detected well in time, intervention is given. Lot of severity and severe mental illness which is being added to our schizophrenic or severe mentally ill population every year, I feel will be minimized, because they will be properly served and detected, and early intervention given at the point of time may prevent the problem turning into severe mental illness. So these are very two crucial significant issues which will be addressed, I think, if you train more people.
Dr. Jagdish, would you like to make a comment?
Yeah, actually, like Professor Singh, Dr. Sagar have said, it's a continuum of care. The counseling, pharmacotherapy, they have to complement each other. We cannot say it's only counseling or it's only pharmacotherapy, the drugs. So they have to be balanced. They have to be complementing each other in a balanced way, so that the patient gets the ultimate final, benefit out of this. And as far as if we take example of mental health, addressing the mental health issues, the team which is there, the mental health team, professional team which is there at the district, if you look at it, the four main people, it's a psychiatrist, it's a clinical psychologist, it's a psychiatric social worker, and it's a psychiatric nurse. So it takes care of all the aspects, all the aspects of care, right from the nursing to the clinical requirement and to the psychological element. So that has been balanced that way. And like Professor Ahilya said, I would like to add and comment to her this thing, because see, the experience of being at a tertiary level care hospital, where you get people who are aware of the counseling needs, and they come to you with their own maybe diagnosis, and maybe they know about the drugs and tell you, and that's a southern state, and a tertiary level care of hospital experience, and that kind of population is very minuscule, and but that tells us that see, awareness is coming, people are coming up with their raised awareness, with their requirements, with their needs. But if you look at the wide scenario, if you look at the countrywide scenario, then in other states, if you look at other parts, other regions of the country, and especially in the rural areas, it is still a problem. And we really need to look at those areas and the kind of population they have, the kind of attitudes they have, and the kind of stigma, like Dr. Sagar mentioned. Stigma is attached to this whole mental health problems, which is a major hurdle even for the program to be implemented. And the stigma is attached to the doctor, the psychiatrist. Not that the people are not going to the counselors, but going to a psychiatrist seeking help for a mental illness. And that is what we are trying to address, and that not only includes psychiatry, that includes this psychology, counseling, and the nursing care also. So we are also running a national mass media campaign for this, to removing the stigma from the mental health problem, so that patients seek help. The families, they don't come out in open, they don't even they try to evade that there is a person who's suffering from mental health problem in the country. So we need to tell, like to remove the stigma, we are trying to emphasize that it's like any other illness, mental illness, and it's treatable, so that they come out, they seek help, which is very important. And we need to focus at other areas, we need to have a wider outlook, and coming up with this counselors and the family therapists. Now the families also, they are getting aware of this thing, and they are forming family groups for caring for the mentally ill in the families. There are many examples in the country, in the states which are advanced, and in the families which are educated, they have formed groups, and there they interact with each other. They even tell us, okay, we need to be trained, we must get the training so that we can take better care of our patients who are there in the family. So these kinds of things are coming up, which are very good, but they need to be spread. It has to be there at that regional balance, so that at every region, at every level, this thing comes up, and this sensitization is there.
Thank you, Doctor. Professor Ahilya, an important point that has emerged from the discussion is the need to shift the focus on addressal of mental needs in the country from the tertiary level to the primary level. So would you like to comment on it in the light of putting counselors and family therapists as frontline workers in the addressal of mental health needs of the country, with the thrust not remaining only at the tertiary level care provision, but being in, as Dr. Sagar said in the beginning of this thing, putting it in the primary health care delivery mechanism, integrating it there itself?
I think when we talk about strengthening the role of counselors at the primary healthcare level, we first of all need to make a distinction between different levels of care, even where counseling is concerned. Because one of the things that perhaps we need to recognize is that not all families are necessarily dysfunctional in their way of interacting with each other, or that they have deep-rooted animosity towards each other and so on. By and large, most of them are actually struggling with making a living for the family, because in rural areas, making a livelihood and subsistence itself is a big issue. And when someone develops a chronic illness, whether it is a mental illness or a physical problem, that really strains the family's ability to cope to the maximum extent. And at the same time, many of these are families who perhaps are not very well educated or who lack knowledge and information. Therefore, if we are talking about the first line of care in terms of counseling being provided at the primary healthcare level, a lot of it, I think, needs to be psycho-educational in nature, in terms of giving information to families about the nature of the problem that they are struggling with, what would they need to do in terms of handling the patient appropriately, which could include things like the importance of regular treatment and regular follow-up visits and so on, as well as dispelling many of the myths that surround many of these disorders. One major issue in the primary health care at that level is families that are struggling with having to care for a child with severe levels of disability, developmental disability, whether it is mental retardation or other forms of disability. That is one group that really needs constant assistance. It is not just that it can be a one-shot effort, it is something that has to be an ongoing kind of a help that is required, help and support, and a lot of it is really educational in nature. Teaching them how to handle that child or how to train that child, where can they access help from, and what would be the most appropriate kind of sources to approach. I think if this much of assistance is provided by counselors at the primary healthcare, that would go a very long way. Family therapy, really we can keep it for, such of those families that really get into major issues of having dysfunctional interactions and things like that. That for many families is not really required.
Thank you, ma'am. So with these cheers comments, it's time to sum up this session. There seems to be no doubt about the fact that family therapy and counseling are vital inputs in terms of addressing the mental health needs of individuals and families across the country. The scope has been dwelled upon. There are a range of situations and circumstances where counseling and family therapy inputs could help the family in coping with whether it's a family member with disability or some dysfunctionality that has come into the interrelationships. There is a clear need about a clear role of counseling and family therapy, both supplementary and complementary in nature, across the levels, right from primary through tertiary levels. On this foundational note, we conclude this session. Thank you.